Hello friends, today we are going to see very important video for medical coding field. As all of us know, ICD-10 CM is common for each and every medical coding specialty irrespective of a new coder or seasoned medical coder. So basically we can think like that without ICD-10 CM there is no medical coding. And also in order to code ICD-10 correctly we need to have good understanding of ICD-10 CM updates. And every year we are going to have two updates. First one is effective from October 1st. Second one is effective from April 1st every year. Mostly October 1st updates are very huge and April 1st updates are very less. As we are approaching April 1st within few days, now in order to code ICD-10 CM, we need to have good understanding of updates which we need to use from April 1st, 2025. So today's our topic name is ICD-10 CM updates effective April 1st, 2025. So first we will see summary related to ICD-10 CM April 1st, 2025 updates. So basically here is the section of ICD-10 CM. Here are the updates. For example, if you take index to diseases and injuries, you have one code deleted. So April 1st onwards, you can't find this code. Okay. And three codes replaced with different codes. We will see those. Three subterms moved to a further level of indentation. Okay. And one spelling correction made in several entries. So basically these updates are related to index to diseases and injuries. As all of us know, in ICD-10 CM we are having index as well as the tabular. If you want to code any diagnosis, first you need to go to the index and you need to code or you need to find the code from the index and you need to cross check in the tabular list. So these are the changes related to index to diseases and injuries. Next we are having few updates related to tabular list of diseases and injuries. So here also one change to subcategory instructions, one exclude one note added and one exclude note one note deleted. Okay. So one exclude one note changes to an excludes two note. One change to an excludes two note and seven additions of an instructional notes. Okay. And also we are having one change to an instructional note and one spelling correction in tabular list of diseases and injuries. So no need to worry, we are going to see all this practically. Okay. So the good news is that there is no change in the updates in tabular table of neoplasms, table of drugs and chemicals, external causes of injuries index. And also one most important thing here is we are having few updates in official guidelines for coding and reporting. So these updates related to COVID most of the time as well as obesity. So we are going to see those COVID guidelines as well as obesity guidelines during this session. So if anyone looking for medical coding jobs in USA, India or UAE, please join in our WhatsApp group. Group link is in the description of this video. And also if anyone looking for free APC's local chapter webinar links, please join in this WhatsApp group link. And also if anyone looking for same day surgery coding training, please message me to 707-526-3939. And also if anyone looking for free videos related to medical coding, please check our playlist. So these are the SCC coding. For example, if you want to enter into SCC coding, please watch this playlist. If you want to learn medical coding, so as we have discussed previously, ICD-10 CM is the basic for medical coding. So you check this playlist, ICD-10 CM playlist. And if you are planning to write CPC exam, you can check this playlist which is named as CPC. First, we will check ICD-10 CM index to diseases and injuries. Okay, basically, as we have discussed previously, we are having few changes in ICD-10 CM index also from April 1st, 2025. So here under D, we are having decrease. Okay, so here decrease is the main term. Under main term, blood is the subterm. Okay, so here they did not change any decrease or blood, but under subterm they have changed glucose to glucose E16.2. Okay, so previously it is only glucose. Now they have changed it to E16.2, glucose E16.2. So under glucose E16.2, they have added three levels. Level 1 E16.A1, level 2 E16.A2, level 3 E16.A3. And they have deleted these three levels. Okay. And also under decrease in glucose, so previously we are having glucose R7309. So previously if you want to code for decrease in glucose level R7309. But April 1st onwards, you will not find R7309, you will find E16.2. So instead of R7309, you need to use E16.2 if the patient is having decrease in blood glucose. Next, we are having dissection main term. Okay. So under dissection main term, we are having pre-cerebral artery congenital non-ruptured Q28.1. Okay. So previously before April 1st, we have Heartland A93.8. Now they have deleted Heartland A93.8. So April 1st onwards, we will not find this one. Heartland A93.8. Next under I. Okay. So here under I, if you find infection, infected or infective opportunities, B99.9. Okay. So under bacterial, we are having few revisions. So infection, bacterial, A49.9 as cause of diseases classified elsewhere B96.89. So previously we are having Coronobacter Sakazaki B96.89. Okay. So they have changed it to Coronobacter Sakazaki A49.8. So what is the change here? So previously, if you want to code for Coronobacter Sakazaki, we have used B96.89. But April 1st, 2025 onwards, we need to use A49.8. So this is the major change. So here they have completed or they are completely changed the code itself. Okay. And also under Coronobacter Sakazaki B96.89. So Coronobacter Sakazaki A49.8. So basically both are same only, but subterm we are having the difference. So here our subterm is bacterial. So here our subterm is Coronobacter. Okay. So next they have removed Pneumocystitis jerovesi pneumonia B59. Okay, and they have added Pneumocystitis jerovesi. So what is the difference here? Just they have added I here. So if you see the spelling difference among first one and second one, so here JIROVICI, but in added code description they have added two I's. Okay, so that is the change. Next we are having change from M. So here myocarditis is the main term, which is having I51.4. Okay. So previously, whenever you want to code viral myocarditis, you are having the option of you need to code I40.0. Okay. But April 1st onwards, if you want to code viral myocarditis, you need to use B33.22. So this is the change here. So next one is P. So Pneumocystitis jerovesi pneumonia B59. So as we have discussed here, there is no change. Just they have added one more I along with jerovesi. So now we will see ICD-10 tabular list of diseases and injuries. So previously we have seen index changes. Now we need to understand tabular list changes also. In chapter 1, so they have added one under tuberculosis A15 to A9. They have added use additional code if applicable for associated cachexia E88.A. So basically what they are telling that if you code A15 to A19 series tuberculosis code, you can code E88.A if the documentation supports. Okay. So and here also under pneumocystosis, so they have revised pneumonia due to pneumocystitis jerovesi to pneumonia due to pneumocystitis gerovasi. So here also same guideline. So just they have added one more I to gerovasi. Next one is chapter 1. So certain infectious and parasitic diseases. Okay. So this is the basically same guideline or same change just we have discussed. So next we will see in the chapter 4, endocrine, nutritional and metabolic diseases E002 to E89. Okay, so here also nothing significant. So under hypopituitarism, they are asking us to code associated cachexia if it is documented in the report. So use additional code if applicable. If applicable means they are telling us if the documentation contains, you can code cachexia along with hypopituitarism. Next, under chapter 10, we are having few changes. So here also nothing significant. So pneumonia in diseases classified elsewhere. So previously we are having pneumonia due to pneumocystitis gerovasi. So basically here only spelling correction. So gerovasi spelling correction. Okay. So under lung diseases due to external agent J62, J70 series. So under J65 series, they are asking us to code associated cachexia along with pneumoconiosis associated with tuberculosis. Here also you need to check the documentation. If it is applicable only, we need to code E88.A. If the documentation does not contain, we can't use E88.A. So under chapter 11, they have deleted excludes 1 constipation K59.0. Okay. So basically excludes note 1, excludes 1 means you can't code K56.41 with K59.0 series. But they have deleted this excludes 1. So now onwards you can code K56.41 along with K59.0. Okay. And under disease of liver K72, K77 series, under K72 they have added again for ascites we need to use R18.8. For example, if the patient is having hepatic failure, okay, so along with K72 you can use R18.8 also. Here also same guideline. So this is K73 chronic hepatitis, along with chronic hepatitis you can code R18.8 also. Okay, so here we are having small change also under K90 intestinal malabsorption. Okay, so under K90.82 short bowel syndrome, so they have added one excludes one note, post surgical malabsorption not elsewhere classified. Okay, so basically they are telling us you can't code K90.82 along with K91.2. Why means here they have mentioned it as excludes one. Okay, so we can't code K90.82 and K91.2. We need to use only one among these two codes. So under K90.822 short bowel syndrome without colon continuity, you need to use colostomy status J93.3 if applicable or if the patient documents in the medical record. So under chapter 14, so under N18 chronic kidney disease, so they have deleted use additional code to identify kidney transplant stage if applicable J94.0. Okay, so they have deleted J94.0. So basically along with N18 series we no need to code this kidney transplant status. So April 1st onwards we need to add any associated cachexia or any kidney transplant status. So basically the wording is changed, the position of the guideline is changed. So under chapter 15, so here under excludes 2, encounter for elective termination of pregnancy uncomplicated J33.2 to encounter for elective termination of pregnancy. So they have basically removed the uncomplicated here. Okay, and here also under O26.64 intrahepatic cholestasis of pregnancy, they are asking us to code if the patient is having hepatic obstruction also. So now we can code O26.64 along with K76.89 if the patient is having intrahepatic cholestasis of pregnancy as well as hepatic obstruction. So from chapter 19, so from injury and poisoning, just they have deleted excludes 1 and they have converted that exclude ones to excludes 2. Okay, so basically now onwards, see, if you want to code P102, P15, along with S00 to T88 you can code without any hesitation. Okay. Next we are having S06 intracranial injury. Okay. So here they have mentioned just except as noted below. So under chapter 21, so they have changed the revised text. Z3A weeks of gestation. So they have added one more category here. Okay, obstetric condition are encountered for delivery O09.060, O82, O82, so O94 to O9A. Okay, so previously we don't have this O94 series. So now we are having the O94 series. So now we will see ICD-10 updates from official coding guidelines. So we have one change here under first section, asymptomatic individuals who test for or who test positive for COVID-19. Okay, for asymptomatic individual who test for positive COVID-19 and there is no provided documentation of a diagnosis of COVID-19, query the provider as to whether or not the individual has COVID-19. So, for example, here patient does not have any type of symptoms. Okay, but that patient is positive for COVID-19. So, using the positive test result, we can't code patient is having the confirmed diagnosis of COVID. So, we need to query the physician whether patient is having the COVID or not. Why means a false positive laboratory test is possible and it is the provider responsibility to confirm the diagnosis and document accordingly. So it is provider's responsibility to provide the correct information related to patient's COVID status. So under chapter 4 we are having significant changes related to obesity. So the obesity categories in A60, E66, overweight and obesity. Basically those are based on reason for the obesity and the condition caused by the obesity. Okay, and also we are having course related to obesity due to disruption of MC4 or pathway and fifth subcategory of complicating pregnancy, childbirth and puerperium. So basically what is the significant change here? So previously if the patient is having morbid obesity and class 3 obesity, we need to code any one or we will code or we have coded morbid obesity code. But April 1st onwards, if the documentation contains both morbid obesity as well as obesity class 3, we need to code only obesity class 3. So the code for obesity class 3 is E66.81 and for fifth character you need to choose level, whether level 1, level 2 or level 3. So okay coders, so thanks for visiting our channel. I hope you are able to understand these latest updates. As usual, if anyone looking for same day surgery training, please contact me using 707-526-3939. And also if you like this session, please click on like button. If you are having any confusion, please mention in the comment section. If you are visiting for the first time, please subscribe to our channel. If you like this channel is very helpful, you can share it with your friends.